2025 under the theme Healthy Beginnings, Hopeful Futures. India's capital tells a grim story where hope is dimmed by a mounting maternal and infant health crisis. In Delhi, nearly 50 women lost their lives to childbirth-related complications every month between April 2016 and September 2022. According to the latest CAG data, between April 2016 and September 2022, 3,777 maternal deaths were reported. The highest spike came in 2021 to 2022 alone, 638 deaths. There has been progress, but is it enough? If we talk about the maternal mortality progress in Delhi from 2014 to 2016, Delhi reported 130 per 1 lakh live births were reported. By 2018 to 2020, the number dropped to 97 per 1 lakh live births. But the Sustainable Development Goals target for year 2020-30 is 70 per 1 lakh live births, and India is still not there yet. 1.3 million women died from maternal causes in India in last 20 years. What's killing India's mothers? As per a NIH study, 47.2% deaths were reported due to hemorrhage, while 12% were due to infections. 6.7% died due to hypertension, and unfortunately 4.9% deaths were due to unsafe abortion. A key underlying factor is anemia. According to NFHS, 5.57% of Indian women aged 15 to 49 are anemic, putting them at greater risk of postpartum hemorrhage, preterm births, and low birth weight. When it comes to infant deaths, the most common causes are malnutrition, birth asphyxia, neonatal infections.
Hypertension-related disorders in pregnancy continue to be a challenge that most of us will face. There will be maternal mortality. A bit of this is preventable, some isn't, but preventable would be to prevent, obviously, the high-risk factors or the predisposing factors. Anemia, malnutrition, etc., extremes of age, pre-existing diabetes, if better controlled, obviously we'll have lesser hypertensive disorders, pre-existing hypertension per se in women, better antenatal care, easier access to well-trained obstetricians and hospitals. So all of this put together will obviously decrease the mammoth of the proportion of the disease.
Dr. Dhawan also called for stricter regulation on unsafe abortions, emphasizing the urgent need for safe reproductive healthcare access in urban centers like Delhi.
We can screen them regularly. We have to do regular BP monitoring of the patients who are pregnant, give them support and prenatal care, and also early diagnosis and implementation of treatment early. Same goes for nutrition also. All over the world, there are unacceptable nutrition levels in women. And we have to make sure that before the pregnancy happens, the nutritional levels are raised to provide reserve during pregnancy.
Dr. Sunita Kapoor, as someone trained in both gynecology and pathology, talks about how critical early screening in detecting high-risk conditions like preeclampsia, gestational diabetes, and thyroid disorders during pregnancy is. She highlights the need for integrating pathology labs into maternal health programs, especially in rural or semi-urban India, to help reduce maternal and neonatal complications. As India pushes for its Sustainable Development Goal to reduce maternal deaths to 70 per 1 lakh live births by 2030, the road ahead demands robust healthcare facilities, increased awareness, and most importantly, political will. Because healthy beginnings is not just a theme for World Health Day, but it is a right. And thousands of mothers across the country, it is still out of reach. With camera person Arun Negi, this is Shreya Ghosh for NDTV.